We are now extremely concerned that several factors may be coming together over the next weeks to months to create a potential perfect storm. A perfect storm of active conflict, limiting our ability to access civilians, distrust by segments of the community already traumatized by decades of conflict and of murder, driven by a fear of a terrifying disease, but also exploited and manipulated by local politicians prior to an election.
In your introduction, and then you were talking more about sort of armed groups politicizing this. Are you more them directly militarily, and if so, are you ready to?
Yesterday, we were only able to reach 20% of the contacts of confirmed and probable cases in and around Beni. So it means that 80% of people that are at risk of Ebola, at direct, immediate risk of Ebola, were unable to be followed up yesterday in Beni. We know this morning that this ville morte has been extended until Friday, so that means this entire week we may have cases that become more symptomatic and become more infectious that we're unable to respond to.
More than 100 armed groups, that's a lot of armed groups, but do you have it?
We also see a very concerning trend, that resistance driven by quite natural fear of this terrifying disease is starting to be exploited by local politicians, and we're very concerned in the run-up to the elections projected for December that exploitation of this very natural fear will gather momentum and make it even more difficult to root out the last cases of Ebola.
You got the border forces. What do you say?
We will not yet consider the need to evacuate, but we are developing a range of contingency plans to see where our staff are best located or relocated in order to be safe while we continue to respond. And really it's not a choice, colleagues. I mean, if WHO and its partners had to leave Northern Kivu, despite the excellent work of the Ministry of Health and their leadership, we would have grave concerns that this outbreak would not be able to be well controlled in the coming weeks to months.